Hi, my name is Sara Pilsner, and I'll be doing my head to toe assessment with Miss Kathy Berkbigler. Um, we're going to start off today with, I just wanted to mention that we did do a full set of vital signs. That includes a heart rate, a pulse ox, a temperature, a respiratory rate, um, and a blood pressure. Everything was within normal limits. We also did tested her vision with the Snellen and the Rosenberg test, and everything was appropriate with that as well. Um, Whenever she walked into the room, I observed her gait as she walked in, and it was steady, and she did not need any assistance with that. So I'm going to first start off with her head. I'm just going to kind of look at everything, and then I'll just talk you through it. So I'm going to look at her scalp. Her hair is evenly distributed throughout. There's no sections where there's any patchiness. There's no dry skin. There's no redness. Nothing like that on there. Um, she's already told me that there's no complaints of pain on her scalp as well. The next thing I'd like to do, you can take your glasses off for me if that's okay. The next thing I'd like to do is just kind of look at her face. Everything is symmetrical. The eyes are symmetrical. The eyebrows are symmetrical. The eyelashes extend up and out. Um, her nose is symmetrical with her face. Her ears are set appropriately. There's not one side is droopier than the other. So that's great. Let me adjust this just a little bit. Sorry about that. So everything's good with that. I'm just going to ask you to just do a few things for me if you don't mind. Can I have you stick out your tongue? Good job. Can I have you clench your teeth? Good job. Can you puff out your cheeks? Like a blowfish? Good job. Can you clench your eyes shut real tight? Good job. Can you smile? And how about wrinkle your forehead? Good job. Those all just tested for some cranial nerves. I'm also going to do a light sensation test. So I'll have you close your eyes and just tell me where you feel this.
Forehead, cheek, right cheek, chin.
Okay, perfect. That's what I need you to do. Thank you. The next thing I'm going to do, I do want to palpate. I'm going to palpate her frontal sinuses and her maxillary and see if there's anything. Any pain?
No, nope.
Good job. Can I have you open and close your jaw? Good. There's no clicking, no bulging, nothing like that. No pain in your jaw either. So that tested her temporal mandibular joint, and everything is fine with that as well. So that's great. I am gonna have, well, I'm gonna do the whisper test. I'm gonna go behind her and I'm gonna say a word and see if she can um, repeat that word to me.
Popcorn, popcorn.
Good job. So she was able to hear all of that, which is good. Next thing I want to do is I want to look at her nose. Her nose is symmetrical. There's no drainage, there's no redness, nothing like that that I can tell. Can I have you occlude one nostril and then breathe through the other? Good job. Next one. Perfect. So her nostril is patent, which is great. I am going to look up in her nostrils. I want to see if there's any deviated septums, if her turbinates are red, and how that is going. So have you look up just a little bit. Perfect. I'm going to look in. And there's nothing occluding, there's no redness, there's no drainage, nothing like that. There's a straight airway through there's no deviated septum in either way. The next thing I would like to do is I'm going to look at her ears. I just want to look and I want to make sure that they are aligned. They're even, there's no drainage, there's no redness, nothing's going on with that. I want to palpate her orbital and her pinna and all that. No pain or anything like that, no pain or tenderness. Good. I am going to look inside of her ear. Good. The tympanic membrane is present on that side. It's a nice gray pearly color. There's no dullness or anything like that in there. And there's also no serum that's occluding anything. There's no serum occluding that one either. I'm sorry. There's no serum, including the left one either, and that looks appropriate as well. The next thing that I do want to do is I want to use the tuning fork. I'm going to do what they call the Weber test, and I'm going to hit this, and then I'm going to put it on top of her head, and I just want to make sure that she can hear that bilaterally in both ears. So just tell me if you can hear this bilaterally in both ears.
Both ears.
Good job. Okay, the next one I'm going to do is also called the Rhines test. I'm going to put it on the mastoid bone back here, and I'm going to have her tell me when she stops feeling that, and then I'm going to put it on the outside of her ear, and that's going to show me air conduction versus bone conduction, and what we're looking for is the air conduction to be twice that of her bone conduction. Tell me when you stop hearing it. 1, 2, 3.
I think it stopped.
Okay. 1, 2, 3, 4, 5, 6, 7.
Faint.
Okay, good. So that is appropriate. Air conduction is twice the bone conduction, so that's what we're looking for with that. Good job. Next thing I want to do is I am going to look at her mouth. I'm just going to observe everything first. Um, her lips are pink. They're appropriate. Um, can I have you open real wide? Good. The roof of her mouth, her hard and soft palate are pink and moist. I'm going to pull down. That is fine. The inner and outer are fine as well. So that's good. Can I have you stick out your tongue? Can I have you lift it up? Can I have you push it down? Go left and go right. Perfect. I am going to have you say ah for me. Good job. The uvula and all of the tonsillar fillers and everything are present. Her teeth are present also. They are white. There is no mouth odor that is noted at this time. So that is great. Okay, you did wonderful. The next thing that I want to do is I do want to look at her eyes. I want to check everything out with them. I'm going to first just look. They're set center to her face. Her eyelashes do extend up and outwards, which is what we're looking for. Her eyebrows are centered over her eyes. There's no hair loss or anything like that with her eyes, so that is appropriate also. I want to pull down. I want to look at her conjunctiva. Those are pink, so that's perfect. Her sclera and everything are white. There's no jaundice or yellow looking to that. Her lacrimal apparatuses are fine. Those look appropriate also. I'm going to use an otoscope and see if we can see a red reflex also. So I'm going to have you look at an object. Good job. I'm just going to come in from this side and look and see what I can see. Perfect. Your red reflex is present over there. And perfect. Your red reflex is present over there. So that's great. Um, Moving on, I do want to look at her neck. Sorry, I do have a little cheat sheet like you said that we could have, so I appreciate that. I do want to look at her neck. I'm just visually just going to visualize everything. Neck is midline. Her trachea looks midline also. I will palpate that here in a second. There's no jugular venous distension at all, um, so that looks great. I am going to palpate for some lymph nodes. So we're going to palpate and we're going to get her preauricular, her post-auricular, excuse my dogs, I apologize, her occipital, her tonsillar, her submandibular, her submental, her posterior cervical, her superficial or her superficial cervical, and then her deep cervical, her supraclavicular. And while I'm doing the lymph nodes, I'm going to have her lift her arms up for me, and I'm going to feel for her axillary. And those are all appropriate. They're non-palpable, which is good. That's what we're looking for. Um, they're not tender. There's no redness. There's no swelling. There's no nodes that can be felt. So that's great. The next thing I want to do, I do want to palpate. I'm just going to feel for her jugular vein for a pulse. That one's present. and that is present as well. The other thing, oh, I'm sorry, my thing went off again. The other thing that I do want to look for is I want to auscultate. I'm going to auscultate for her carotids, and I'm also going to take auscultate for her thyroid. But first, I want to palpate and see if we can feel her. Well, no, I'm going to auscultate first. So hold your breath. Okay, breathe in now. And hold again. Okay, and hold again. So no bruises, thrills, or anything present with her thyroid or with her carotid. So that is perfect. That's what we're expecting. The other thing I'm going to do, I'm just going to have her take a deep swallow, just a real strong swallow, and I want to palpate for her trachea. Okay, so palpate real swallow. There you go. And you can also feel the outline of the thyroid as well. So that's perfect. Next thing that I would like to do is I want to look at her upper body, her upper extremities, so her arms. So I'm just noticing her arms. I just want to see if she can put them out to the side, her side. Perfect. That's what I want to see. And I'm just gonna look at her arms for distribution and color. Everything is fine. Everything is fine. There's some age spots on there or some sun spots on there, which there's no. The borders are symmetrical. There's nothing to be worried about with that. I am gonna look at her capillary refill, and that is all appropriate. And it's less than 30 seconds with all of her extremities or all of her fingers. I'm gonna have her squeeze my hands real tight. Good job. Just squeeze my hands. Good job. So I want you to go like this for me. I don't want you to pull me. I don't want you to be able to push me. Okay. Good job. I'm gonna try to push. Good job. That's perfect. All right. Go ahead and relax. I'm gonna check for your brachial pulse and your radial pulse. I'm gonna do that over here as well. Okay, that's perfect. So that's all appropriate. That's all good. We're within normal limits when it comes to her upper body. The next thing I would like to do, I do want to look at her heart. I'm going to palpate her chest. I'm going to inspect her chest and everything like that. So I'm just kind of looking at her chest. There's no barrel chesting. She's not having any trouble breathing on her own. She's able to do all of that completely appropriately. So that's what we're looking for. There's no heaviness on her chest, nothing like that. So that's great. I am going to palpate her chest. Any pain there?
None.
Good. I am going to feel, I'm going to, for her apical pulse. That's going to be fifth intercostal space midclavicular line. So that is present as well. You're not having any chest pain at all, correct?
None.
Perfect. I'm going to listen to her heart sounds. So we're going to start with her aortic, and then her pulmonic, Erb's point, tricuspid, and her mitral. Wonderful. I'm gonna go from behind, and I just want to look and see her chest expansion and all that as well. So you can stay right there. I just want to look from behind over here. And I'm just looking at her chest too, just her posterior chest, just to make sure that there's no nodules, no masses, nothing that's visible that I can actually see. I am gonna test for tactile firmitus, so I'm gonna have her say 99.
99. 99. 99.
Perfect. So that is present. You can feel a slight vibration in her chest, which is great. The next thing I want to move on to is I do want to move on to her lungs. I'm going to listen to them. Um, we'll percuss them, um, and we will go from there. So I'm going to listen to her real quick. I already have looked at her inspiration and expiration are just fine. Um, I'm actually going to do a diaphragmatic. Oh, I'm sorry, the thing keeps going off. I am going to do a diaphragmatic excursion on her, or expansion, and everything like that. So big deep breath. Good. One more time. Good. So whenever she's breathing in and out, when my hands move, it's about 2 to 4 centimeters, closer to about 3 centimeters, maybe just a little bit more, which is appropriate, and that is exactly what we're looking for. So I am going to take a listen to her. I'm going to have her take a bunch of full deep breaths. Big deep breath. Wonderful. We're going to go to the back of her as well. Big deep breath. I'm going to listen laterally. I'm comparing each side as I do this. Good job. Everything sounds great. I am going to percuss the back of her too. I just want to make sure that there's no fluid or like dullness or hyperresonance in there. So I'm just going to go along and just percuss. Alrighty. Everything looks wonderful with that. The next part of the exam that we're going to do is her abdominal exam. So I'm actually going to have her lay down back here for me. Remove all of this stuff for you. I'm going to pull her shirt up just a little bit. Perfect. And if I needed more light, I would use more light, but I have a pin light and I have this light above me. I'm just looking. Everything looks fine. There's no pulsations that need to be addressed. Her respiratory rate is in and out, and it's appropriate as well. So I'm not worried about anything with her abdominal area. There's no nodules. There's no masses that are present, anything like that. So as far as looking at it, color is appropriate. As far as looking at it, it looks great. I do want to auscultate just a little bit. I am gonna auscultate all 4 quadrants. You can do it up to 2 to 5 minutes. I'm gonna, for time reasons, I'm gonna auscultate just to hear and show you that I can see all 4 quadrants. And then also I'm gonna do all of her arteries, aortic or aorta, renal, iliac, and her femoral arteries. So all 4 quadrants, and they are gurgling. I'm gonna listen for her aorta, and her renal, her iliac, and then her femoral. And there's no bruise or thrills that are um, heard there either. So that's wonderful. That's what we're looking for. Um, The next thing I do want to do is I want to percuss for some her liver border and her splenic border. So I'm going to start up a little bit higher, and we're going to percuss until I hear a little bit of a change. All right, so I will mark my line over here, and then I'm going to work my way up. And I do hear feel the change is about 4 centimeters. The change. I'm sorry, my computer keeps going. The screen keeps going out of me. So there's about 4 centimeters, which is appropriate. And then I am going to percuss over here for her spleen. And I can feel or hear her spleen when I percuss. Next thing I'm going to do, I'm just going to lightly palpate just to see if there's any tenderness or anything that she's or any complaints that we may have. So just a little light tenderness or a light palpation. I'm sorry. Any complaints there?
No complaints. No tenderness.
Next thing I'm going to do, I'm going to deep palpate. Any discomfort?
No discomfort.
Perfect. I am going to palpate for her aorta pulsation, and that is present. I can feel that. The next thing I do want to do is I'm going to palpate for her left and her right liver, or sorry, her left and her right kidney. So if I can have you take a deep breath in, all right, and I can feel that one, and then a deep breath. Good job. That's great. The other thing I want to do is I am going to palpate for her liver. So another deep breath in. All right, perfect. Deep breath in and all the way out. Good job. I can feel that. I'm sorry if I heard my nails are a little long. And so I can feel that. And then I'm going to palpate over here just to see if there's any splenic distension. And there is not. So that is great. And that's wonderful. So I am going to have you sit up. As she's sitting up, I'm just observing for her muscular strength, and that is appropriate. This bed's a little squishy, so it is a little bit harder to get up. I'm going to watch as she walks over here, too, and as she sits down, everything looks fine. I'm going to have her sit down for me, and then I'm going to have her sit back just a little bit. My screen's about to go on us again. So I'm just going to look at her legs. Hair distribution is even. There's no open wounds, no open sores, nothing like that that I can see on her legs. It does not look like they're edematous. I will touch them to make sure that that is right. So I'm just going to look. I think you can see me. I'm going to check her popliteal pulses. Those are present bilaterally. I'm also going to check her tibial pulses, posterior tibial. And then I'm going to check her dorsal pedal, or pedis, sorry. And those are appropriate as well. I'm going to check her capillary refill in her feet and her toes. And those all look appropriate too. I'm going to push against her and have her not let me push. So push it. Okay. And I'm going to pull. Good job. And that's appropriate as well. I do want to check a couple reflexes with her. I'm going to use my reflex hammer. I'm going to check her knee reflex, so just let your knees hang freely. And then I got a little twitch on that leg, and I got an even bigger twitch on the next leg. I am going to go up here and do a break. You'll just relax. There you go. I got a little twitch from that hand, which is good. And I got a little twitch from that one too. And I'm also going to do her Achilles. Just relax your leg. Good. Got a little one from the foot. I got a little one from the other foot as well. So those are all appropriate as well too. Um,
The band-aids from when I shave my legs.
I feel the last thing that I want to do after I conclude this, I do want to have her stand up. I want to look at her spine, cervical, lumbar, and all that, just to make sure that there's no curvatures, there's nothing deviating left or right, make sure everything's okay. So I'm going to lift up her shirt just a little bit. From a standing position, everything looks fine. And I am going to have her bend at the waist. Good job. And come back up for me. Everything looks fine and appropriate there as well. Go ahead and sit back down for me. Perfect. I think that concludes my head to toe assessment. Thank you so much. I appreciate everything you do.